All right, welcome to The Explainer. Today we're jumping into a huge shift in how patients find and choose their doctors. You know, the days of just relying on a good reputation around town, those are pretty much over. Patients have gone online, and for healthcare practices to really succeed, they've got to meet them right there. Okay, let's get into it.
And this slide just lays it all out, doesn't it? The patient journey used to be so local. You'd hear about a doctor from a friend, maybe catch a radio ad. But look at the Now column. It all starts with a Google search. It's guided by online reviews from total strangers. All the research happens way before a patient even thinks about walking into an office. The whole game has gone digital.
And just to give you a sense of the scale here, get a load of this number. 1 out of every 20 searches on Google is about health. That is a mind-blowing number of people actively searching for answers, for information, and yeah, for doctors online. This isn't some little trend, it's the new reality.
So here's our game plan for today. We're going to start by really understanding this new type of patient. Then we'll talk about your new digital waiting room. After that, we'll get into the practical stuff, building your online practice, getting patients to find you, and maybe most importantly, earning their trust. And finally, we'll wrap it all up and see what this means for the future.
Okay, first up, the patient has changed. Before we can figure out how to reach them, we have to really get who this modern healthcare consumer is. Now, this is super interesting. What are people actually searching for? It's not just doctors near me. Look at this, almost half, 45%, are digging into specific procedure information. Another 37% are researching conditions. See, they're not just looking for a name, they're looking for expertise and answers. Which leads us perfectly to our second section, your new waiting room. If patients are online looking for answers, then your website, your social media, that's the first place they're going to sit, learn, and form an opinion about you. And the key to making that a great experience is something called inbound marketing. So, what is inbound marketing? It's a total shift in mindset. Think of it like this. Instead of yelling at people with ads, that's outbound, you're being a magnet. You pull patients in by creating genuinely helpful content. You become a trusted resource for them before they're even your patient. This whole strategy really stands on 3 big pillars. First, you've got search engine marketing. That's all about making sure you're the top result when someone Googles a health question. Then there's social media marketing, which is where you build a real human connection with your community. And finally, mobile marketing. Because let's be honest, if your website is clunky on a phone, you're basically invisible.
All right, let's get into section 3 and start building. We're talking about your digital practice. And the absolute cornerstone, the digital front door to your entire practice, is your website.
A modern medical website can't just be an online brochure anymore. It absolutely has to work perfectly on a phone. The whole thing needs to be built around what the patient needs, not what the practice wants to talk about. A huge piece of that is a deep resource section. Remember, they're looking for answers. And all of this has to be tied together with one strong, clear strategy, making it ridiculously easy for a patient to learn what they need and book that appointment.
Okay, so you've built this fantastic digital front door. Now what? How do you get people to actually show up? That brings us to section 4, attracting online patients. This is all about cranking up your visibility.
And it really comes down to these 3 key steps. First, you have to target the right keywords. That's like learning the exact language your patients use to search. Second, you create fresh content that uses that language to answer their questions directly. And third, you bring it all to life with high-quality video.
And when we talk about keywords, you don't have to guess. The data tells us exactly where to focus. Remember that 45% of people searching for specific services? And get this, over half of consumers choose a hospital based on how convenient it is. So keywords that combine what you do with where you are, that's the magic formula.
And why all the fuss about video? Well, because it just flat out works. A landing page with a video can see an 80% jump in conversions. Think about it. Video is perfect for explaining a complex topic or even just introducing your team. It builds a human connection long before they walk in your door. Moving on to section 5, and this is such a critical piece of the puzzle, earning digital trust.
It's one thing to get someone to click on your website, it's a whole other thing to build a relationship. And that's all about reviews and social media.
You know, this quote just absolutely nails it. Today, patients are checking you out based on what other patients have said. They want to know about your communication, your empathy, your bedside manner. The diplomas on your wall get you in the game, but it's your reputation that wins it.
And that brings us right here. It's actually a pretty simple idea. What your neighbors used to tell you over the backyard fence, they now post on Facebook for hundreds of their friends to see. Social media is just word of mouth with a massive megaphone.
So, how do you actually use it? It's not about just blasting out updates. It's about starting a conversation. You share patient stories, you post helpful articles and videos, sure. But the real trust gets built when you engage, when you answer questions and open up new ways to communicate, showing people there's a real, caring human on the other side. All right, let's bring it all home with our sixth and final section, the future of patient care and how all these different pieces connect.
So here's the big takeaway. None of this works in a vacuum. Your website, your content, your social media, your keywords, they all have to be working together, totally in sync. When they do, they create this powerful engine that doesn't just attract new patients, but helps you build lasting relationships with them.
Which leaves us with one last, pretty important question to think about. This whole digital shift, it isn't on the horizon. It's already happened. So you have to take a hard look at your own practice and ask, are you showing up where your future patients are already looking? Thanks for joining us for The Explainer.